Hi, I'm Dr. Fodero. I'm a board certified plastic surgeon here in New Jersey. I have been doing facelift surgery for 26 years, and today I'm going to talk about my approach to facial rejuvenation. Facelift, or really facial rejuvenation in general, is this evolving field. So I have been a plastic surgeon for 28 years, and so I've seen facial rejuvenation evolve in almost 3 decades. And so this is my experience. So I was a med student at Yale in the 90s, and I saw a lot of surgeons performing facelifts. There really wasn't a lot of non-surgical treatment at that time for facial rejuvenation. So when I was a med student, no one was doing Botox, no one was doing fillers. There were some lasers and there was dermabrasion and things, but really if you wanted to rejuvenate the face, you had to operate on people. Through the years, there have been different procedures that have come out to rejuvenate the face, to make people look younger, healthier, and they all have merit, but each one of them has to be evaluated on its own. There are some things that can be done to the face, especially for younger patients, that can be quite enhancing. So the neurotoxins, the neuromodulators like Botox, Dysport, and the other brands are really wonderful for improving the forehead, changing the position of the brow. And there's a lot of people that are doing these things because they work and it's easy to do. You come to see a provider, you have the service done, and then you see some nice gentle rejuvenation. The energy-based ways to rejuvenate the face, and I think that no one does it better than reflections, can be really wonderful as well. So the things to resurface, the skin tightening devices, they definitely have some application for specific patients. But those things tend to work better for younger patients. So when somebody has loose neck skin, they have ill-defined jawline, they have a jowl, they have deficiency in the midface. A lot of those patients can't be managed with non-surgical means. And the reason is that the non-surgical techniques are simply not powerful enough to rejuvenate somebody who has extensive facial aging. So for those patients, they benefit from surgery. And so my approach to surgical facial rejuvenation is that you want to do the right amount of surgery for each patient. So I tell all my patients, you want to get the right amount of surgery. You don't want to over-operate on somebody, you don't want to under-operate on somebody. And what does that mean? So if you have loose neck skin, you have an ill-defined jawline, you have heavy jowls, you need to do an operation that's going to correct those things. So nobody wants to have an operation and still have loose neck skin. Nobody wants to have an operation and look strange. So for every patient, what I try to do ideally is just the right amount of surgery to rejuvenate the face, to make them look younger, healthier, but not strange. Plastic surgeons have spent a lot of time talking about how we age, studying how we age. And I think that if you have 2 pictures of a person and you have one when they're 20 years old and one when they're 50 years old, anybody instantly would recognize what the younger face is. We know youth when we see it. Plastic surgeons have spent a lot of time trying to quantitate what it is. What's going on in the face? What's atrophying? What's sagging? And then once we have an idea of what's happening with aging, then we can talk about, well, what should we do? There are certain common patterns of aging that we see. So the creation of jowls or loose skin around the jawline is very common. Loose skin of the neck is very common. A deficiency in the cheek is very common. But every patient will age differently. So it's not necessarily how old you are, it is what changes have occurred at that point in your life. And so those people typically present complaining about their necks. And they say, well, I really hate my neck. But what they need is they need most of the work to be done in the neck, but they still need some work done in the jawline and face. And then there's some people that will come back and say, well, my neck isn't what bothers me, but I hate my jowls. I hate this laxity, this stuff that hangs. I hate that what they call it a marionette line, where you have a line from the corner of the mouth and down because this tissue is literally hanging over. And so for those patients, we do a little bit different operation. And then there's some people that have deficiency in the midface more than they have changes in the jawline or neck. And so you would design an operation to correct that. If there's one element that we see across all of aesthetic surgery, face or body, is that we want harmony. You want balance. And so if you're doing a nose, you want the tip and the bridge of the nose to be balanced, to be in harmony. If you're doing facial rejuvenation surgery, you want the rejuvenation to be blended. You want the cheek to match the jawline, to match the neck. And although people will often come in with a specific complaint, they don't like their neck, they don't like their jawline, they don't like their cheek, what you want to do is you want to provide rejuvenation that's balanced. I think an important concept for facial rejuvenation, especially now, is what treatments are appropriate for someone's face. So for younger patients, we often don't recommend facial rejuvenation surgery. They can be treated non-surgically. So things like neurotoxin, neuromodulators, Botox, Dysport, and the other products that are available. Fillers like hyaluronic acid, energy-based devices like resurfacing lasers or radiofrequency tightening, they're all appropriate. There does come a time when those modalities are simply not powerful enough to rejuvenate the face, and that's when an artfully done facelift or eyelid surgery is the most powerful. But what I have found, especially in the last 5 years, is that if you have a patient that was doing non-surgical treatment, and at some point they need surgery, when you have surgery, what you're essentially doing is you're resetting the face. So when I was first a resident, we would do a facelift, and we would do eyes, and we would do brow surgery, and that's all you could do. And so those patients basically had to wait till they needed surgery again. But what we do now is we have a patient who needs surgery. Once they have had surgery, once they've had a well-done facelift, once they've had their eyes done, then that face is a more youthful face. And that face can then be managed with a little bit of filler, a little bit of neurotoxin. So it used to be that people thought of non-surgical or surgical, but really it's a synergy of surgery and non-surgical rejuvenation. And the way to get the best results at this time is to use all the modalities. In my practice now, my primary focus is aesthetic surgery of the face and body. So the vast majority of what I do now as a surgeon is cosmetic surgery of the face and body. So I do a lot of facial rejuvenation surgery, and I do a lot of breast and body work. But there are parts of my practice that are not cosmetic. I do facial fractures, I do surgery around the orbits, I do broken noses, I fix broken cheekbones, I fix broken jaws, I do those things. And they only make me a better facelift surgeon. So to me, although at this point in my career, I do focus most of my energy on aesthetic surgery, and so the vast majority of my elective practice is cosmetic surgery of the face and body, there's still a component of my practice which is reconstructive. I do love doing an artful facelift, I love doing a great nose, but there's still, to me, something that's important about fixing people that are in car accidents or people that have been assaulted. And so that's still a big part of what I do. My father was an excellent physician, an excellent surgeon, technically excellent fund of knowledge. And he told me when I was a young boy, he said, there's nothing worse than a mediocre physician. So if you're gonna do this, you have to be excellent because it's just too important. So I have put a lot of my life's energy into being excellent at what I do, right? This is not a part-time job for me. This is my passion. This is what in large part defines who I am, and it can't be any other way. So we've covered a lot of things in this video, but if anybody has any concerns specifically about their face, I'd love to see you in consultation here at Reflections.